Good day. This is the Professopher, CBMD PhD, and today's Monday, December 12th, 2022. It is 3:27 and 21 seconds a.m. Eastern Standard Time. And today's research, estrogen. So let's hop to it here. The estrogen may offer protection against delirium. Date December 8th, 2022. Source, Cedars-Sinai Medical Center. As delirium is common among women with urinary tract infections, especially those who have experienced menopause. Investigators working with laboratory mice have been able to prevent symptoms of the condition with estrogen, which is commonly used for hormone replacement therapy. There has been a resurgence of interest in hormone replacement therapy, and this study, which builds on the previous work, shows that it may be a tool to mitigate delirium. Delirium, a change in mental abilities that includes lack of awareness of one's surroundings, a common problem in older women with urinary tract infections. And for example, even as a medical student, you know that if an older woman comes to the hospital and she is confused, one of the first things you check is whether the patient has urinary tract infections. And in previous studies, the team of researchers found a connection between delirium and an immune-regulating protein called interleukin-6. Events such as lung injury or urinary tract infection cause interleukin-6 to travel through the blood to the brain, causing symptoms such as disorientation and confusion. Estrogen is a known suppressor of interleukin-6, so the investigators designed experiments to test its effects on urinary tract infections induced delirium. The researchers compared pre- and postmenopausal mice with urinary tract infections and observed their behavior in several types of specialized experiments. They found that in mice in which menopause had been induced exhibited symptoms of delirium, such as anxiousness and confusion, while the others did not. When they treated the mice with estrogen, levels of interleukin-6 in the blood and delirium-like behavior were greatly reduced. The behavioral differences were not related to urinary tract severity, as bacterial levels in the urine weren't markedly different between the two groups. The scientific investigators also looked at the direct effects of estrogen on neurons using what is called a urinary tract infection in a dish. They exposed individual neurons to an interleukin-6 inflammation cocktail to create urinary tract infection like injury, but when they added estrogen to the cocktail, it mitigated the injury. And so, we showed that there are at least two ways that estrogen helps reduce symptoms of delirium. It reduces interleukin-6 levels in the blood and protects the neurons directly. Questions remain about exactly how estrogen acts to protect neurons, and before conducting a clinical trial, researchers need to identify which patients with urinary tract infections are most likely to experience delirium, and at what point estrogen treatment might be most effective. As currently, it is common practice to treat urinary tract infection-induced delirium using antibiotics, even though there is no clinical trials that indicate this practice is effective, and it is not supported by clinical practice guidelines. And this work is an important step in determining whether modulating immune response via estrogen replacement or other means is a more effective treatment. The team is also working to understand the different effects of delirium on female versus males, which is not a topic of this study. Effective treatment of delirium could be of a long-term importance because it is a known risk factor for long-term cognitive impairments such as Alzheimer's disease and related dementia. And this is the Professopher, Professor of Microbiology, Bioinformatics, and Pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.